Vodafone believes connectivity to be a key enabler of innovation and a building block for change. Working in partnership with NHS organisations, private and third sector suppliers, Vodafone is supporting work to reduce inequality in healthcare access across the UK. Aligned to the Vodafone purpose, it is also providing solutions through its campaign, everyone.connected, to help empower patients and support the healthcare system into the future.
At this GP surgery in Slough, connected technologies are transforming the patient experience.
Nice to see you, Miss Barella. How are you doing?
Good afternoon, Dr Priya. It's my shoulder again.
Like using virtual appointments to bring family doctors into people's homes.
What we really want to do is empower our residents to come on this digital training we're going through in the NHS, and Vodafone's giving us that opportunity. So things like online consultations, remote monitoring, text messaging, electronic prescriptions, the more we can do through technology, the more we can remote monitor people at home and enable our staff in mobile working. So for example, in March 2023, we've launched the multi-generational household project with Vodafone, and they enabled our staff to be on the road. So we're reaching out to people who are not engaging with us through the traditional routes of primary care.
But what happens if you're not connected to an increasingly connected world? In a recent survey, 3,300 people here in Slough were asked the question, in the last month, have you had access to the internet? 8.8% answered no. Everyone.connected is hoping to address that digital inequity.
Everyone.connected is Vodafone's commitment to eradicate digital poverty. And we've given away 1 million free connections, and we'll give away 4 million by 2025. That allows people to have equal access to healthcare. We feel it's our responsibility to help the NHS develop for the next 75 years. And we support services like NHS 111. We have over 5 million calls a month on NHS 111. We're connecting patients and we're connecting the NHS to patients. And that doesn't have to be in GP surgeries or hospitals, it can actually be in their homes. We're trying to work and make the NHS workforce more connected, and that's really important. And then I think the third thing that we're looking to connect is the new technologies, the assets and the capabilities that Vodafone has, our partners have, with the capability and assets of the NHS.
As part of its commitment to the NHS, Vodafone is working in alliance with other suppliers in health. Some are small and bring clinical innovation and transformation. Others are much larger, like the consulting firm Deloitte.
What we're trying to do is deliver better care, more efficiently, and to ensure that we make the best use of our resources. And in effect, for a clinician, that means having more time to deliver care. It's not just about the technology, but the way that we embed that technology in complex, evolving healthcare systems. This is a complex problem requiring complex solutions, and we can truly bring the best of digital and tech innovation to our healthcare clients. Reserving our hospitals for the things that the hospital needs to do, and making sure that we have a very strong community and primary care offer to support the welfare of people outside of the hospital setting.
I think there's a sense of purpose, but also a sense of health, and Vodafone in health being technology driven. So Great Ormond Street, working with our partners, Kinseed, when the ambulance is coming into the hospital, there's a live feed and there's live data transfer of what's taking place with the patient. So as soon as the patient arrives, the team are ready and the NHS staff are prepared. We work with a company called Proximity, so it's remote surgery. So you could have a surgeon based in Seattle who's maybe operating on a patient based in Coventry. Be it with 5G, be it with IoT, but predominantly using the capability that Vodafone has.
The NHS can't do this on its own. We need the big tech companies like Vodafone. And how do we then start to expedite the speed at which we want to digitally change the NHS? And it's only just to improve care for patients.
And from GP practices to hospital trusts, helping patients and practitioners to embrace the technology, preparing the NHS for the next 75 years.
All right, thank you, Miss Barella.
Bye.